Hello everyone, today's video is another Q&A video talking today about mycoplasma, talking about biofilm disrupting capsules, and talking about why some folks might feel worse taking a high-dose vitamin D protocol, specifically with a slant if that person has multiple sclerosis. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind please taking a quick moment to like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here is, I'm having issues with Mycoplasma genitalium. I've tried every antibiotic you can think of, doxycycline, cefirocin, moxifloxacin, and most do eradicate the symptoms, but it comes back after a week or so once the course is finished. I'm getting really desperate. The doctors here don't have any clue. Please, any help is much appreciated. So I'm sorry to hear that you're going through that. And man, oh man, mycoplasma can be really, really persistent. Of course, I can't give any advice over social media, but just talk a little bit academically about some of the cases that I've seen with really persistent Mycoplasma genitalium. I do have other videos about this as well, so feel free to search my YouTube channel. It's the easiest way to search old videos, I think, and other posts about this as well. So when it comes to Mycoplasma, there are certain herbs that can be really helpful. Some of the herbs that I use in my practice with my patients with Mycoplasma genitalium would include Cryptolepis, Alcornia, Sida acuta, Chinese skullcap, also known as Scutellaria bicalensis. Those are kind of some of the top, or in another one called Hutunia as well. So herbs that were kind of popularized more by the late Stephen Buhner, a brilliant herbalist. And so those are the types of herbs that I will oftentimes use in my practice. And then I'll oftentimes, for the really persistent cases, I will combine that with a biofilm disruptor. So really strong, the strongest biofilm disruptor I'm aware of is a combination of either DMSA or DMPS, a chelating agent, and then a dithiol complex incorporating R+ alpha lipoic acid and bismuth subnitrate. So that combination at a fairly high dose, sometimes several months. I mean, I hate to say that because like, oh my gosh, several months, but like it could take quite a long time to eradicate this. So it is really the way I talk to my patients about it, kind of conceptualize it in my practice, is we're really kind of working to marinate the tissues in these things to just really get rid of the bacteria, get rid of their hiding places. Sometimes I will bring other things into the mix as well, but those are some of the most common things that I will use. Sometimes I'll bring in some D-mannose just for good measure. Not a ton of research looking at that for Mycoplasma to my understanding, although I do believe that there's a little bit of research showing that it can help to disrupt biofilms to some extent, probably not in a really strong way, but that's my understanding of it. Sometimes we'll use low-dose immunotherapy for Mycoplasma, so there's other things we'll bring into, but it just really depends on the individual case. But yeah, with patients I've worked with, the big take-home message that is oftentimes missed is just not treating for long enough with a robust enough approach. And yes, we got to remember those biofilms. So I hope things are better for you soon, and thank you for the question. So next question here was posted on a video, a video about, or a video posting of a podcast episode that I did with Dr. Sanya Tamburek, talking about vitamin D receptor resistance. I think it's Sanja, actually. Sorry, Dr. Tamburek, mispronouncing your name there. I'm sure you're not watching this video, so I'm sure I haven't stepped on your toes there. My apologies. I haven't talked in a long time, forgot how to pronounce her name. So that's the context here. In vitamin D receptor resistance, Dr. Tamburek was talking about prescribing like particularly high doses of vitamin D and how that can be used for a variety of different conditions, particularly autoimmune conditions, and MS being one of those. So the question here is, why do some people feel worse after treatment? Some people go from relapsing, remitting multiple sclerosis to secondary progressive multiple sclerosis after treatment. Is this a natural progression or a treatment trigger? I want therapy, but I'm worried about the comments. So I don't remember seeing a bunch of, so thank you for the question. I don't remember seeing comments on my video, at least, about concerns about sort of progression of MS from this type of treatment. So I'm wondering, not really sure where those comments were, but maybe I'm just missing something. I'm not sure. I have worked with many patients over the years with an MS diagnosis, and I don't feel that I've ever seen any natural treatments that I've recommended lead to an exacerbation or worsening of MS symptoms. I've definitely seen detox symptoms, many detox symptoms in patients over the years. I really try my hardest to not provoke those detox symptoms. I try to recommend things at a pace that seem to be fast enough to get the patient's results as quickly as possible, but not going so fast that we're provoking detox symptoms, die-off symptoms, that type of thing, like Herxheimer reactions, etc. But the best laid plans sometimes just don't bear the fruit that we expect that they're going to, or there are some detox symptoms along the way. That's what I'm trying to say in some cases, despite best efforts. But in terms of actually seeing like a worsening of disease, I don't know that I've ever seen that before. I can't say definitively that I haven't, because there's just too many unknowns in all branches of medicine. But generally speaking, I've seen things slow down. With MS specifically, it seems that we've seen a slowing down of progression. We've seen a halting of progression. I have seen cases where follow-up scans have shown a reduction in the size or number of lesions on a follow-up MRI. Now, sometimes the patients are doing things outside of what I've recommended as well, and so I can't always know exactly where to attribute the benefits to, but I've seen improvements, and I have had patients where they have objectively not been doing as well over time, but I don't believe that that's been related directly to treatments that I've been recommending, or that maybe they're working with on their own. My wife and kids just got home, so if it's noisy in the background, my apologies. Hopefully the microphone will be just specific to my voice and not to theirs in the background, so apologies if you can hear them there. But in patients that I've seen like kind of a worsening of symptoms over time, it's maybe related more to the natural expected disease progression, or that type of thing, not like, oh, it seems to be directly attributable to the treatments that we've been working with. So that's just been my experience up to this point. But I think that feeling transient worsening is something that does happen sometimes with like respect to detox or Herxheimer reactions, but I don't think that, say, a vitamin D receptor resistance protocol would lead to an actual like a genuine worsening of pathophysiology. So one more question on here, and just got to scroll down to it here. Okay, so the last one here says, will taking a combo of bismuth subnitrate, alpha lipoic acid, and DMSA, i.e. the strong phase 2 biofilm disrupting protocol that I mentioned just a minute ago, will that disrupt my hormones? It's being used for biofilms for a urinary tract infection, and is it safe to take throughout the cycle? I'm trying to conceive and get rid of this weak lingering UTI, very weak since I killed the majority with antimicrobials. So, great question. I'm not sure if those agents have a direct impact on hormones or not. I'm not aware of those specific agents having a direct impact one way or the other, like increasing or decreasing those different hormones. That being said, when we're working with that strong phase 2 biofilm disruptor, where one of the ingredients is DMSA, DMSA also helps to promote detoxification of different compounds in the body. It's not just a biofilm disruptor. It helps to get rid of certain synthetic chemicals, helps to get rid of certain heavy metals. As those things are being flushed out of the system, liberated in the system, then that could potentially upregulate or downregulate the different components of phase 1 and phase 2 liver detox, and that could potentially have an impact on the degree to which hormones are being metabolized. So it could have an indirect effect in that way, but I'm not aware of a direct effect, but I don't know for sure. What I will say is that I do recommend biofilm disruptors to my patients throughout their menstrual cycle, so we don't change it, say, oh, like never take it during menstruation or never take it during ovulation. I don't make those recommendations for my patients. What I will say though is that I'm very careful and judicious about using any kind of detox around conception. So just being really extra mindful about what kind of supplements are taken around that time in a person's life. I hope this is all of interest, and any other questions, just post in the comment section below.